Hi there, I'm Danielle Roberts. Have you ever heard of Medicare excess charges? If not, you'll want to know about them. Excess charges can significantly increase your out-of-pocket costs, so it's important you know how to avoid these surprise bills. Excess charges can be charged to you if your doctor doesn't accept Medicare assignment. Let me explain what that means. Some doctors accept Medicare but do not agree to Medicare's assigned rates. So if your doctor doesn't accept Medicare assignment, then he or she can charge up to 15% more than the Medicare approved price in many states. That 15% is called a Part B excess charge. This charge, of course, is on top of your 20% Part B coinsurance that you already have to pay. For example, if you see a doctor who doesn't accept Medicare assignment for a service that has a Medicare approved price of $300, that doctor could charge you up to $345. Assuming you've already met your Part B deductible for the year, Medicare will cover 80% of the Medicare approved price of $300, which is $240. You'd then be stuck with paying the other $60 plus the excess charge of $45 for a total of $105. Had you seen a doctor who accepts Medicare assignment, you would have only paid $60. There are two main ways that you can avoid excess charges. The first way is to simply ask whether your doctor or provider accepts Medicare assignment. If the doctor tells you he or she doesn't accept assignment, you have the option to seek treatment instead with a doctor who does. However, if you really love this doctor and don't want to choose another, then you'll at least be aware that you're going to end up owing some excess charges in the end. That's where Medigap plans come into play, which are your second way to avoid Part B excess charges. There are a couple of Medigap plans that cover these excess charges for you at 100%. Medigap Plan F and G include coverage for excess charges if you were to see a doctor who accepts Medicare but not Medicare assignment. Another Medigap plan that has grown in popularity over recent years is Medigap Plan N. Plan N is similar to Plan G in some respects. However, Plan N doesn't cover Medicare Part B excess charges. Some people enroll in Plan N because it usually offers lower premiums compared to Medigap Plan G. However, depending on your doctors and how often you see them, the savings may not always cover the difference if you get smacked with too many excess charges. I'll share a client story to help you understand what I mean about this. We had a client who enrolled in Plan N to save about $15 a month in premiums. We explained that she would need to ask all her doctors if they accept Medicare assignment and that the small $15 a month savings in monthly premiums may not be worth it for the hassle. However, she said, "Hey, that's no problem. I will ask all my doctors before making any appointments." Well, within just a couple of months of enrolling in Plan N, our client developed a health issue that caused her some rather frequent trips to go and see a certain specialist. And because the client lived in an area with few options for that kind of specialist, she ended up seeing the one who didn't accept Medicare's assignment rates. I should also remind you that Plan N has some copays. When you visit a doctor, you might pay up to $20. So our client was not only being billed excess charges, but she was also having to pay a copay for each doctor visit. So shortly after she got several bills with excess charges, she called us and wanted to switch to the Medigap Plan G. Fortunately, she was still within her 6-month, one-time Medigap open enrollment window, so we were able to change her plan for her without her having to go through any medical underwriting. Had she called us later, though, outside of that Medigap open enrollment window, she may not have been able to pass the underwriting necessary to switch over to Medigap Plan G. What I want you to take from this story is that if you're interested in Plan N, just know that you will need to check with all of your doctors and maybe even lab testing facilities to make sure that they accept Medicare assignment. I want you to also weigh the savings and premium with the possible copays as well as the possibility of incurring those excess charges. Now, one bit of good news, there are a few states that say they don't allow doctors to charge excess charges. And these states are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and also Vermont. However, these states can create their own rules, and there may be some fine print that you need to read before you assume that your state doesn't allow excess charges in all cases. For example, in Connecticut, this rule only applies to people below a certain income level. Therefore, depending on your income, you may still experience some excess charges in Connecticut if your doctor doesn't accept Medicare assignment. For more information on how Plan N compares to Plan G, check out this video. And thanks for watching. I'll see you next time.